Well, every life is important in our diverse West Michigan community. A way to reach more women at risk is through Spectrum Health's Healthier Communities. So where do Latina women come into play? We're here to tell us more about More Life Más Vida. That program is nationally recognized menopause specialist Dr. Diana Bittner, along with RN case manager Gladys and Isabel with More Life Más Vida. Good morning, ladies. Thanks for being here.
Good morning.
Yes, or buenos dias, right?
Buenos dias.
Yeah. All right. Speaking of the Latino women, I mean, where do they fall into this risk category?
Well, you know how I love to talk about heart disease risk reduction, and we don't want people to have preventable illness. Latina women are at higher risk for diabetes and heart disease because of their genetics. And we're so lucky to have More Life Más Vida here at Spectrum Health, and it's helped so many women.
Yeah.
And with me are very important members of the team.
Absolutely. So tell us a little bit about this program.
So this is a free program, like Dr. Bittner said. We serve mostly Latina and African American people, but it's open to anybody.
Okay.
And it is a cardiovascular disease and diabetes prevention program in our community. So we start off with a screening, a biometric screening. We check cholesterol, blood sugar, height, weight, and blood pressure.
And it's fun, and it's friendly.
And it's fun and friendly. And so from there, we kind of gauge risk factors for a person, and then they get to see me and a couple other care managers that are nurses. We have community health workers that will also help people in our program to find community resources if they need, because we know that health is not just the clinical aspect.
But there's barriers, right?
Yeah.
Because there's a lot of barriers. There's a lot of barriers to care. And we know also that if you aren't living in a healthy environment and have access to medicine, well, to medical help and food and safe places to live, then that's going to affect you physically.
Yeah.
Right. We usually get referral from clinics and agencies in the community, and we make them part of the program this way, and we serve them for a whole year.
Wonderful. And you guys have seen some amazing results, right?
Yes.
From this. I mean, we go back to, I think it was back to 2013 is kind of when they started looking at everything, and some of those results that came from it were
It's
astounding.
just so impressive. I mean, they're impressive in any group of patients, but to have low cholesterol, lower blood pressure, lower weight, and have people engaged and have fun. And there's lots of stories that we could tell.
Right. And we have one story we want to tell is a patient named Lydia.
Not her real name, of course.
Yes.
Do you want to talk, Tanya, about?
Yeah, we can talk a little bit. So she's not a super unique case, is what's pretty cool about this. Is a lot of people hear word of mouth within the community, and they, their family sometimes is their impetus for joining this. They want to live longer.
Safe, right?
They want to feel safe in an area where they just know that they're going to be accepted.
Yeah.
And so they'll come in, they'll get everything checked, like I said.
So what happened with Lydia?
Yeah, so she was really engaged, is what was awesome. She came in and got checked out. We found out that she was at higher risk for some of these things. She also was able to take part in the mammograms that sometimes we partner with. Actually, every year we partner with the Betty Ford Breast Care Services.
Yeah, and like last year, 40 women got mammograms because of this program.
Yeah.
And that can be, there's a stigma around that, isn't there, in the Latina community to get a mammogram?
And free of charge.
Yep.
And free of charge. And as early as 18 years old, right? You're eligible at 18?
Yes.
Not for the mammogram.
Not for the mammogram,
yes.
for the service.
Yes. So the program is just you need to be at least 18 years old and not already have diabetes or cardiovascular disease, have had a heart attack or a stroke.
But what was fun with Lydia is that she joined the program, right? And she got engaged, and even just simple changes. Instead of a white flour tortilla, a whole wheat tortilla.
Yeah.
Instead of white rice, brown rice.
Yeah.
And she lost weight, like.
And then this is something they start off a ripple effect. They start this early with their kids or their grandkids, and then they carry that on. And so we start seeing those percentages flip around, and they don't just accept, well, you know, it's my ethnicity. That's just the way it's going to be. You just don't have to accept it like that, right? Do something about it.
No, those little changes change the whole household and also their communities. Because their friends see their changes, their lifestyle changes, and they are a very good example for others to follow.
That's right. If you're going to be a statistic, be a good statistic, right?
Yes.
Well, there you go.
There you go. All right, and if people want to find out more information, where can they go?
Oh, you know the phone number.
They can call us at 616-391-6199, and I will speak with them and tell them everything about the program and enroll them this way.
Wonderful. And if you go to spectrumhealth.org and you type in healthier communities, that'll all come up there too. Thank you so much
Exactly.
for stopping by.
Thank
You're doing
you.
a wonderful thing
Thank
for
you.
our West Michigan community.
Happy holidays.
Happy holidays to you. Hey, and to set up an appointment with the Midlife Menopause and Sexual Health team at Spectrum Health, call 616-267-8520. Their offices are located on the west side of Grand Rapids at 3800 Lake Michigan Drive Northwest, Suite A, and then the east side of Grand Rapids at the Integrated Care Campus on East Beltline.